I'd naturally say give it another try. Um, I think what I'm trying to convey here is that unless you support this innate wisdom, you're going to have not the best results. And if a person has tried alternative medicine before, there's so many different types of practitioners um, with different. A person goes to 5 different practitioners, and each one of them might design a different program for you, and each of those individuals might have their own special point of view about how to address illness. You go to one person and you might receive, some type of heavy metal detoxification program or chelation. Another one you might go to that specializes in, supporting the liver and the kidneys and that approach. Another one might just be focusing on nutrition, which is really, really important. But unless you're looking at the causes of the progression of a person's symptoms and illness based upon causality, so to speak, it's going to be a hit and miss situation. So if I were that person, I would listen to what the physician has to say. I'd look at the rapport, the exchange of the conversation, consultation. Are they listening to what you're saying? Are they looking for the details of how your condition evolved? Are they making recommendations for helping to nutrify all the cells of the body, to remove toxins from the system, and to address very likely a load or burden of pathogens that have accumulated over time, especially those people who have taken a lot of antibiotics, because often the antibiotic can get rid of maybe 90% of the infection, and there's still 10% left over, and that the bacteria left over have developed a certain resistance and remain in the body. So addressing pathogens, bacterial viruses, and molds is extremely important in helping people to recover their health. And how do you assess that is challenging as far as, does a person carry with them a burden of pathogens in the system? I use a dark field microscope. I don't diagnose using a microscope. I don't, as many people that are using dark field, say that your pH is off, your liver is not working properly, all these different subjective interpretations of what is seen under the microscope on the screen. All I do is to simply look at the red cells, if they're well spread apart or if they're all stuck together, which means they're having an issue with oxygenation of tissues. How large or small are the white blood cells? We get a report back from the lab, what's called a complete blood count, which says the count of white blood cells, but we have no idea the viability of those white cells, what size they are. You can actually see under the microscope the actual activity of the white blood cells and see if they're active or not. So those are very, very simple observations that doesn't require any subjective interpretation. And you can also see bacterial pathogens in the blood if it's prepared in a certain way. This is medicine. We're doing that in research, and it's nothing new. So be careful about who you're seeing for a dark field. It should be extremely simple, looking for 3 or 4 major things that might be an issue for people. So again, I'd say give an alternative medicine another try if you've not been successful before. Try to come in with, again, an open mind and ready to be educated and have a sense of whether the doctor you're seeing who's doing alternative medicine is really listening, is really empathetic to what you're going through, and is investigating, using you as his or her source of understanding how you've developed this condition. And then look at the therapies that are being offered, and does a doctor only have 1 or 2 therapies that they can recommend for you, or is it really more of a holistic approach, various therapies that can help the body to detoxify and to recover?